Hey there and welcome. Now, if you're an expectant parent, I know you've got a million things on your mind. So today, we're going to clear up one of those topics that you might hear about, something called RH incompatibility. The good news? It's totally manageable with the right care. So you might have heard this question floating around. And yeah, it can sound a little scary at first. But what does it actually mean if your blood type and your babies don't quite line up? Let's dive in and break it all down. All right, first things first. What in the world is RH incompatibility? Let's pull back the curtain on this medical term. I promise, it's way simpler than it sounds. Okay, so here's the deal. It all comes down to a tiny little protein on your red blood cells. It's called the RH factor. If you've got it, you're RH positive. If you don't, you're RH negative. Simple as that. Now, the only time this becomes something we need to pay attention to is in a very specific situation, when an RH negative mom is carrying an RH positive baby. And yep, this is the exact combo right here. It's important to note we're not talking about your A, B, or O blood type here. This is all about that positive/negative difference in the RH factor between mom and baby. That's it.
Okay, so we know what it is, but the big question is, why does this matter? Let's get into the potential risks and, more importantly, why catching it early with screening is a total game changer.
So here's the science behind it, in simple terms. If a little bit of the baby's RH positive blood happens to mix with the mom's RH negative blood, her immune system kind of goes, whoa, what's this? It sees that RH protein as something foreign, like a germ, and starts making antibodies to attack it.
Now, this is a really important point. This whole antibody thing, it's usually not a problem for the first baby. The real concern is for any future pregnancies with another RH positive baby. Why? Because once those antibodies are made, they stick around, ready and waiting. But wait, before you start to worry, let me just say this loud and clear. We've got this figured out. This is a super well understood situation, and modern medicine has a really simple, really effective way to prevent any of this from becoming a problem. So if there's one thing to take away from this, it's this. Our incompatibility is a totally manageable condition. It's not something to be scared of, it's just something to be on top of with your doctor. Being proactive is absolutely everything. So if the whole issue is the body creating these antibodies, the solution is pretty logical, right? We just need to stop them from forming in the first place. And that's where the hero of our story comes in, something called the anti-D injection. And of course, that leads to the next big question on your mind. What exactly is this injection? And, the most important question of all, is it safe for me and my baby? And the answer is a huge, resounding yes. It's totally safe and it's incredibly effective. You can think of it like a little message to your immune system that just says, hey, stand down, nothing to see here. It stops those antibodies from ever being made, which is what protects all your future pregnancies. So when do we need to be thinking about this? Well, it starts with knowing your blood type and the baby's father's, but it's also really important to think about after any event where there's a chance blood could have mixed. We're talking about things like a previous miscarriage, certain medical procedures, or if a past pregnancy was already affected. Okay, so with all that in mind, what does this actually look like during your pregnancy? What can you expect? The great news is there's a really clear, predictable plan that your medical team will walk you through. Basically, the whole process breaks down into 5 main steps. It all kicks off with a simple blood test for screening. Then comes the prevention part, with that anti-D shot at just the right times. If it's ever needed, there's monitoring with ultrasounds. Then, after your baby is born, their blood type gets checked, and from there, a plan is set for any future pregnancies. See? Very step by step. Let's zoom in on the timeline here because timing is key. You'll get screened early on in the pregnancy. Then there's a routine injection that usually happens around the 28-week mark. Another one comes within 72 hours after you deliver. And of course, you'd also get one if there's any other time there's a risk of blood mixing, like after a bleed or a miscarriage. All right, we've got the whole framework down. Now let's tackle a few more of those really common questions just to make sure we're all on the same page. Okay, this is a big one. I know we've talked a lot about future pregnancies, which is great, but what about the baby I'm carrying right now? And the answer here is fantastic news. As long as it's managed properly with that early preventative care, the risk to your current baby is super, super low. I mean, that's the whole point of the plan, to make sure this pregnancy is safe and healthy, along with any others you might have down the road.
Right, but what if you're in a situation where you already have those antibodies? Maybe it's from a pregnancy that happened before this kind of care was standard or for some other reason. What happens then?
Well, even in that case, there's a plan. Your doctors and nurses will shift gears from prevention to monitoring. They'll keep a very close eye on your baby with regular blood tests and special ultrasounds to make sure everything's okay. And they'll be ready to step in if they need to.
And last but not least, let's look to the future again. If you get the anti-D shot just like you're supposed to, what does that mean for having more kids later?
This is really the whole magic of the plan. Because you're stopping those antibodies from ever forming now, you're basically protecting your ability to have another healthy pregnancy later. It's like each pregnancy gets a fresh, protected start. The goal is always the same: keep you and your future babies safe.
And really, that's the bottom line here. With the right care and information, what sounds like a scary medical thing just becomes a simple, totally manageable part of your pregnancy. It's not about fear at all. It's about feeling empowered and confident. It really just makes you think, what else can you tackle with that same kind of confidence?